Everyone to the MACC podcast. It's Laurel Hansen, MACC's Program and Member Engagement Manager, with another episode of the Workforce Solutions podcast, brought to you by the Metropolitan Alliance of Connected Communities. Interested in checking out more of our podcasts and nonprofit workforce resources? Visit our Workforce Hub on the MACC website, mac-min.org. As our listeners know, MACC has been strategically focused on the well-being and resilience of the human services workforce, and wow, we need it more than ever. We're going to talk about that today, but before I jump into that, just want to say thanks to all of you listening who are doing the work of nonprofit organizations. You're very important to us and to the communities we serve. So I can't wait to jump in on today's episode. We're having a conversation with Warren Duncan. He was one of my favorite people at this year's MACC Summit. He's from People Incorporated's Training Institute. And we're going to talk about compassion, fatigue, and burnout in the nonprofit sector, something I know we can all relate to. So welcome, Warren, to the MACC podcast. Thanks for being with us.
Laurel, thank you for having me.
Hey, Warren. It's really great to connect with you again. I referenced the summit. You did a terrific presentation on burnout at MACC's 2025 member summit. And I was really excited to be able to dig a little deeper into the topic with you today. So let's start by learning a little bit more about you and People Inc.'s Training Institute. You're just a wonderful resource that is available to our members. So tell us about yourself. What's your role? Who and what is the Training Institute for, and what are people turning to you for these days?
Absolutely. So the Training Institute is part of the nonprofit People Incorporated. People Incorporated, it's a Minnesota nonprofit that has a spectrum of behavioral health services in Minnesota communities. So the Training Institute's just one piece of that. But the Training Institute brings high quality adult trainings to the community through the lens of behavioral health. I first became connected to them as a partner. I come from the housing world. I've worked in the nonprofit sector for over 20 years, close to 25 years. The majority of my career has been in permanent supportive housing. And so it was just a nice fit to join the Training Institute, to have that lens, working in the community, talking about building upon the work that I've done in housing, now to all these other groups where it's just about connecting with people.
That's wonderful. I'm talking to the right person, because then you really get what it's like for our members who work in human services, and many of our members are in the housing community. So you get it. What are organizations turning to you for these days? What are you hearing and seeing?
I think it's a lot, there's this theme around connection, and there's a lot of different situations that folks are encountering, staff of programs are encountering with the folks that they work with each other around disconnection. And so, we hear a lot of people talking about de-escalation or boundaries, or this idea of compassion, fatigue, and burnout. There's been a high amount of groups reaching out to us to facilitate a conversation. What does that look like? What can we do? How do we make a connection?
Yeah, right. You're hitting the nail on the head. And I made a note here. I wrote down de-escalation and boundaries. Those are two areas we haven't talked about yet. So maybe round 2 with you, we'll have to go down that path.
Anytime.
You've piqued my interest. I can't imagine a more difficult time to be in the caring professions that our members work in. The organizations who are members of MACC, I know from our conversations, they're undervalued, understaffed, and uncertain about the future. And that's like a trifecta that's really troubling. So what are you seeing in the nonprofit sector? What do you think's going on? Why are we feeling undervalued, understaffed, and uncertain?
I think that uncertainty really matches my perspective. I think there's a lot of unknowns out there in the sector as far as, we look at what's happening in our community. Things are getting more expensive. Wages are staying the same. There's all these changes across the behavioral health landscape around funding, what's appropriate funding or what's going to be available, or Medicaid is up in the air, and that's a big source of funding. I think that's trickling down to the staff, that they're feeling that. I feel certain topics now I don't know how this happened, but it feels like it's become political, like around DEI. And so now we think about, as far as training and initiatives that we're going one way are suddenly stopping. And I think that's contributing to what's happening here. What's going to happen? Will my job still be here? Or, will funding be cut around this area?
Yeah, I think we're all on the same page with that. And my next question for you is, it's a big one, and I'm not sure it's easy to answer, and I know we're going to dig into it, but what can be done to support our teams?
Yeah, that's
right?
I think part of
If it
it is
was
just having
easy,
a
we do it, right?
conversation around this. I think acknowledging it. It's funny, like in the mental health world, there's the saying, and you've probably heard of it, Laurel, kind of name it to tame it. Have you ever heard of that? Like when you're feeling a big feeling, just by naming that, it helps mitigate that intensity of the feeling. I think the same concept is here too. Just by being able to identify what's going on is huge. In compassion fatigue, it used to be that it would be looked at as there's this thing that's happening out there, and if it happens to you, like this compassion fatigue, this vicarious trauma, if it happens to you, then you need to do something about it. It was almost like it's something you get from the program participants that you're working with. And if you get it, then you have to do this. It was almost like a performance issue. And I think that's changing now, where we talk about kind of the impact of this stuff. It does take a toll on you. We're exposed to these tough situations. And by being able to identify it, to start having conversations about it, to normalize it, that it's not, there's something wrong with you, this is part of the work, is how you can steward as far as this stuff that we're exposed to.
Yeah. That is very eloquent. And I think you might have just named our podcast episode, Name It to Tame It. I like it. And I know we're going to talk a little bit more about those sorts of internal conversations that teams can be having. At MACC Summit, of course, you spoke about compassion fatigue. Your presentation was on compassion fatigue and burnout. And I was thinking about compassion fatigue, and it's not an oxymoron, right? You can experience both things at the same time. You can have compassion and have fatigue. Is there a way out from compassion fatigue?
I mean, I think so. I think the tricky thing is, even in the name with compassion fatigue, there's so many names for it out there. There's vicarious trauma, or secondary trauma, or burnout, or mission fatigue. I've heard with groups, and it's all kind of around the same thing. It's this being worn down. I think the piece is, as far as being aware of what the impact, like what your signs might be of feeling this, and then putting together a plan as far as in what you do out work and outside of work, to help bring balance, to help remember, as far as that passion that you have when you come in here, that doesn't necessarily go away, but sometimes we're not thinking about it, and we're thinking about some of the negative things that we encounter. And by just having little tools in your plan to remember the good things too, that helps bring that healthy sense of balance.
Yeah, I was thinking about that secondary trauma. Like you said, how do you mitigate the impact of the experience? Really, recognizing that. And I also think it shows our humanity, and it is a side effect of that. But I just think, like, mitigating the impact, is there, other than recognizing it, are there steps that can really make a difference?
I think so. I mean, it's funny. I remember my first day working in a housing team. I worked on a mobile team, scattered site supportive housing in the Twin Cities metro area. And my boss's boss told me that the average burnout for my position was 2 years. And when I heard that, I remember it because it was my first day and it was my boss's boss. But that's something that always stuck with me. And I've seen that, but I've also seen folks that have been doing direct care in housing for a lot longer than 2 years. I mean, like 10, 15 years. And the way they work, they seem just as passionate as I imagine they were on that first day. And so it's like, what's the difference between, them and everybody else going in there? And I think a lot of it are just subtle ways that they go about their day, their mindset. And so I think, by incorporating some of those practices that they're doing into the work that we're doing, and there's all sorts of ways to identify what they're doing, that's helpful in creating your own personal plan. I mean, the topic of compassion fatigue it's a really different topic than some of the other topics we talk about at the Training Institute, like boundaries or de-escalation. Like that's about the folks that we work with. Here now we're talking about us. Right. And so it's really personal. And it's just like, well, what is a good plan for us? And I think that's part of the insight as far as what am I already doing to help me have balance in my life? And what are some other things that I can incorporate to have better balance, or where might I be lacking, right? Maybe I'm good in this area, but maybe in this area, not so much.
Yeah. Yeah, I get that. I get that. And I also want to dive into what organizations can do. Because we do often have it on the individual to be like, take care of your own burnout. And yet I believe there's a role for the organizations. And I wonder what leaders should be watching for in their organizations. And, are there some organizational strategies that can be effective to sort of preempt some of the, I'm sure there are folks in organizations in that position, like the experience you had, where their turnover is high, to say the least. So, yeah, what are some organizational things we should be watching for and doing?
Yeah. Oh, I think that's a great piece. Well, the first bit is, with the supervisor and their staff, normalizing this, talking about like what are some of the characteristics that might pop up due to compassion fatigue or due to some of the critical incidents that we experience. And that can be, it can be physical, it can be emotional, behavioral. And what does that look like? And starting to have conversations as far as like, how does that manifest in yourself? Like for me, when I'm in a period of heavy lifting at work, I'll notice, things get a little harder. Like I'll start getting headaches maybe, or I have like a little cough that starts to pop up. And ordinarily not a big deal, but it can be a data point when I notice it, is like, what's that about? That feeling of worn down. Am I thinking a lot about work lately, outside of work, when I don't want to? Like, that's a sign. Dreaming about work, right?
Oh, yeah. Been there, done that.
That's a sign. Yeah, I mean, I think we can all relate to that. That's a sign of compassion fatigue. And it's just paying friendly attention to that. And then it's talking about your capacity regularly with your supervisor on check-ins about, as far as if you're feeling a little bit crispy, what's your capacity to new projects right now? Where is that? And the hard part is, we're balancing that with all the work that we're already doing.
Yeah. There are some boundary overlaps there, aren't there? Giving our team members the grace to have some boundaries in place if they need to.
Absolutely.
Yeah. I also think too, what if it's the leader of an organization experiencing burnout? Is there something that a team can do to support a leader and improve conditions?
That's a really great question. When I'm talking about starting to normalize this, there's this sense of creating this sense of psychological safety that I can
There
talk
you
about
go.
this and I'm not going to get in trouble. And I think when we're talking about like communication, that can go both ways. And I think of if there is that sense within the team's culture of that psychological safety, that does allow a leader to receive feedback, right, from trusted team members.
Mhm.
Being thoughtful in how you say it is always, for me, when I've always managed up in my role, being really thoughtful in how I communicated. But just if you notice something, I notice whatever the observable event is a nice way to say it. I was
Mhm.
wondering if it might be something. What do you make of that? These
Mhm.
open-ended questions that we use a lot with the people that we work with are really applicable to use with each other,
Yeah.
right? And having that honest conversation about the nature of the work and bringing it back to, we're here for a purpose, right? And what's that purpose? And so, how can we get the job done? How can we get the work done?
That is excellent coaching, Warren. I really appreciate that, and I like how you brought it around to having that culture of psychological safety. Then maybe you even become a work culture that's comfortable with transparency versus stoicism. And I think in Minnesota, a lot of folks are maybe a little guilty of taking stoicism a little too far, and it can be powerful for a leader to be transparent with their how they're doing.
I wonder, yeah, I wonder, and it's being vulnerable. I think is hard
Hmm. Yeah.
sometimes, and it's being thoughtful too. And you're in the leadership role. I
Mhm.
do recognize that people look to you as far as to be that rock, but still being able to stay connected to hear that feedback. I think is valuable for anybody, for any team, any collaboration.
We're talking about some really terrific topics here today with you. Uh, Psychological safety, that sort of culture of transparency, being vulnerable, the approach around burnout. And one of the things in your materials that you have shared with us is you suggest that teams set time aside. So either at a staff meeting or a one-to-one to what you called to address resolutions to organizational amplifiers of compassion fatigue and burnout. So an organizational amplifier is a great way to say what's triggering us, right? What is the tipping point? What is keeping our work life balance in check? And building that in, I absolutely love that. And did you come up with that? And how can we all implement that?
No, actually, I think that was an adaptation of the work of Francois Mateu, who does a lot of
Mhm.
work around trauma, secondary trauma, and teams. But I love it too. And when you think of amplifiers, and what does that mean? Is it gossiping, right? Is in the organization the culture of blaming others for when things go wrong, or there's low accountability, or there's unproductive meetings? Like all these little things, right, that contribute to poor results can be amplifiers of the stress. And so when we're in that, like our stress response is always firing, and that then will produce symptoms of compassion fatigue. It kind of makes sense when you start looking at it, right? Like, oh, this is just making things worse right now, but it's being able to say, okay, that's what this is.
Such a great takeaway. And I hope to maybe bring this up and suggest that we try this as a team. I think it's a great concept. And again, brings everybody, creates that transparency, right? Everyone can participate, everyone can have a voice, and they can feel like speed bumps in the way of our being effective in our work and being happy in our work. I think we're always trying to revisit how can we have happy teams, right? How can we have people enjoying their jobs and their work. In tough times, that's a hard nut to crack.
Absolutely.
Yeah. You have to share, you've already shared a couple of anecdotes, but I want you to share a personal story if you're comfortable with doing that. What do you personally do to prevent burnout in your own life? Because you, as a trainer, right, you have a demanding schedule and you're working with lots of organizations and folks who are struggling. So that's got to feel never ending. Do you have any stories you can tell from your own experiences?
Absolutely. Yeah, I have lots of stories, but I think of as far as what's been helpful for me is being part of a great team. Like, I really appreciate the folks that I work with at the Training Institute and People Incorporated, and the fact that, you know, the organizational culture normalizes these types of conversation as a way of supporting staff. Um, I think of, in my life, I have two young kids. Don't ask me how old they are because I don't know. They're getting bigger every day. But I know when I've spent time with them, when I was in a period of high stress in my career, sometimes they called me out. I remember in a previous role that I had before joining the Training Institute, I was, we were experiencing some really just significant challenges in the workplace. And it was really hard for me not to bring that stuff home. This was around the time of social distancing. And I remember my youngest at the time, she was really young, would overhear these conversations, and she said, "Why are you blaming everybody for everything?" And for me, that was a real kind of aha moment. Like, I wasn't aware that's what I was doing, and I was having this conversation with my partner here, and, the kids are doing their own thing, but I was so kind of stuck in this kind of spinning my wheels situation that it was coming home, and I was bringing it home. And so hearing that was, it was some tough feedback from a little one, but it was helpful in looking at the situation. And as far as, like, part of this is my mindset on focusing things that I can't control, and, like, shifting my strategy for engaging. And so, when you think about paying attention to what's happening, where things are going, I think that's a big part in helping you figure out, what do I need to do to navigate these tricky moments? Because every position that we're in, we're going to have these periods of heavy lifting, and we have to figure out what's the best way to get through that. Where do I turn in, like, my toolkit around compassion fatigue, on things that I do, things that I cope that are productive? Where can I go? And then having that sense of a trusted person being able to tell you, as far as, like, that thing that you need to do, you might need to do that, like, right now, and to be like, oh yeah, my strategy, I need to go here, or I need to do this. I'm experiencing this now, so I need to incorporate this strategy as I navigate through it.
I love that. And thank you for giving us a glimpse into your own experiences. I appreciate what you shared about having a trusted person, right? Having somebody, it could be in your personal life. It could also be in your work life, if you've got trust built with your colleagues, that you're willing to be transparent and vulnerable, and they're willing to maybe give you some constructive feedback as well.
Absolutely.
Your approach is, yeah.
Laurel, but that you got to foster that trust. Like, you have to be really intentional about creating it, and it takes a lot of time.
Yeah, that's what I was thinking. The intentionality of that comes to mind, and it's a very conscious forward approach to. I mean, I liked what you said, where you were like, I have to stop and really think and use my toolkit of things that I bring forward when I'm struggling. And I think that's a wonderful approach, and probably something we can learn from. This has been such a great conversation. Obviously we really enjoyed having you at the summit. Your presentation that you did there was top notch, and great resources were provided. But before we wrap up, maybe just give us a little bit more direction on the People Institute People Incorporated Training Institute, like how can organizations that might want to seek out some of your services, like what's the next, what steps can they take to learn more about your catalog and learn more about all the great trainings you do?
Absolutely. So visiting us at our website, which can be found through People Incorporated or training. Oh, oh shoot, it's not up here. But reaching out to us at training@peopleincorporated.org if there's any interest in talking with us about something that works for your organization. Our email is traininginstitute.org. And so feel free to look us up. We have over 40 classes along 4 different tracks. Our core track, which is related to a lot of direct care. We have a clinical track where we partner with adjunct trainers who are experts in their field for these clinical trainings, as well as a leadership track for new leaders. And brand new is a children and mental health track that we just started this year that I'm really proud of the content.
Right on. I'm glad to hear you have the new leaders track. Our sector, there's definitely a lot of new leaders coming in, which is a good thing, but it just means a lot of change in organizations. So that's helpful. Yeah, I will share with listeners that I found your catalog by going through the People Inc. website. It was very easy to find, and I was very impressed with the catalog. There were a number of sessions there that looked just really beneficial. Are your trainings mostly for organizations, or can individuals access them? How does that work?
Yeah, they're for everybody. We partner a lot with organizations, but we also have public classes that anybody can sign up for.
Okay, well, that's good to know. This has been a terrific conversation with Warren Duncan. Thank you, Warren, so much. We learned a lot from you, and it really brought up some great thoughts and some great strategies. And I was glad to learn more about your training institute as well. And just thank you so much for your time in the conversation with the MACC Network. And I'd also like to thank the sponsors of our Workforce podcast, which are the Ameriprise and Schultz Foundations. Listeners, we appreciate you. Don't miss MACC's monthly podcast downloads. We're on the Podbean platform, or find our episodes directly on MACC's website. Have an idea for a MACC podcast guest? Please reach out to us. So I just want to say thanks to everyone. Have a great day and be well. Goodbye.